Hello, my name is Dr. Krishna Padiyar. I'm with Secours Acumed, and this presentation will be about COVID-19, or as most people will know it, the coronavirus. Our first topic will be about the coronavirus itself. As you can see, there is a model of the coronavirus in most of these slides. It's usually a small spherical shape with projections from outside. These sizes are about 1 micron thick, which are pretty thin and can pass through most surfaces. So COVID-19 is an infectious disease caused by a virus known as SARS-CoV-2, or as most people know it, the coronavirus. Before the outbreak originated in Wuhan, China, in December 2019, there was no information about this specific type of coronavirus. Now understand that in the past we have had coronaviruses, and we have found them as far back as the 9th century BC. You can see here we've had different types of coronaviruses even during the BC era. The most recent coronaviruses have been the SARS epidemic, which was severe acute respiratory syndrome, which was between 2002 and 2004 and was started in Guangdong, China. This version of the coronavirus basically was limited to Asia at the time. Another type of coronavirus was something called MERS, which was Middle Eastern Respiratory Syndrome, which was a 2012 outbreak and mainly centered around countries in the Arabian Peninsula, such as Saudi Arabia, Syria, Iran. So what makes COVID-19 so special? Both MERS and SARS were more lethal. In other words, more people died when they were infected, but they were less infectious. In other words, how transmissible they were than COVID-19. MERS and SARS were quicker to identify and easier to contain, making transmission less possible. Many infected with COVID-19 usually showed mild symptoms, usually in the first stages. But the important thing you need to understand is that most people did not have symptoms and would transmit and can transmit COVID-19. As such, you can catch COVID-19 from an infected person who only had a mere cough, didn't feel too ill, or didn't have symptoms at all. So there are two methods of transmission. The most common method of transmission is through people. This means that it's spread from person to person, usually through small droplets when an infected person coughs, sneezes, or exhales, or merely in the presence of a person who does not have their mouth covered, depending on the amount of aerosol transmission of saliva there is. A less known possibility of transmission is surfaces. Usually the thought is that these small droplets will land on the surface and the person who touches it can get in their eyes, nose, or mouth. However, with respect to transmission to surfaces, it should be noted that it has not been proven. It's only been shown that coronavirus can survive on certain surfaces for certain periods of time, but it's not known whether it is infectious or how long it's infectious when it touches the surfaces. So for all intent and purposes, it should be noted that people are the most people transmission is the most common way of transmission. So what are the symptoms of COVID-19? Well, these are pretty standard symptoms that you would expect from a person who may have viral symptoms, such as high fever, which means that your temperature exceeds 99.9 degrees Fahrenheit, shortness of breath, dry cough, and when I talk about dry cough, that means irritation and constant coughing without mucus, such as like a croupy cough. It could be fatigue and tiredness, muscle aches, nausea and vomiting, or a loss of smell and taste. It's also important to know that you may not have symptoms if you have COVID-19. If you have symptoms and are diagnosed, the most important things you can do: stay at home for at least 14 days after symptoms and diagnosis, or self-quarantine. Self-monitor for symptoms, which means do temperature checks twice a day, and watch for fever, which was, as we defined, greater than 99.9 degrees Fahrenheit, cough, or shortness of breath. You also want to avoid contact with people who are at higher risk for severe illness. So who are these people who are at higher risk for severe illness? Well, this is a good list that hits pretty much most of the people. This would include people 65 years or older, people who live in a nursing home or long-term care facility, people with chronic lung diseases such as moderate or severe asthma or COPD or emphysema, people who have serious heart conditions, people with severe obesity, which means your BMI is greater than 40, people with diabetes, chronic kidney disease and undergoing dialysis, liver disease, or if you're what they call immunocompromised. In other words, your immune system is not working as well. How can you be immunocompromised? Well, certain ways, such as cancer treatment, smoking, if you've had bone marrow or organ transplant, immune deficiencies, poorly controlled HIV or AIDS, or if you're using steroids for another condition such as asthma, or other immune weakening medications such as Enbrel or Humira, which can be used in things such as rheumatoid arthritis or even Crohn's disease. But the big thing to remember is about 80% of people recover from the disease without needing any special treatment. So what are some statistics about the coronavirus? With respect to mortality, as of March of 2020, as you can see, the mortality compared to flu is pretty significant, but usually starts to rise significantly after the age of 50, with almost doubling or in some cases tripling of the death rate as you go by decades above 50. This is a chart from May 13, 2020, which shows you the number of COVID deaths that we've had up to this date. And when you compare it to influenza viruses by age range, you can see that at some points you're even going up to 16 times the death rate. Again, as we saw in the last slide, these death rates start to increase significantly from ages about 50 and above. Please understand that when compared to flu, it is definitely much more lethal. However, the numbers are still relatively small. As of May 19, 2020, we've had about close to 5 million cases worldwide with about 320,000 deaths. The 5 countries with the highest number of cases as of May 19th show that the US is still the highest number of confirmed cases with the highest number of deaths. However, next to us is Russia, Spain, Brazil, and Germany. As you can see, we have many confirmed cases as well as many deaths. This is a good map to show you how widespread the coronavirus is. Understand that the map takes into account tracking in different locations, which is why you will see that the US and Europe have better data than maybe some other countries. This is what they call the COVID incidence rate, which is the number of confirmed cases per 100,000 people. As you can see, this is mainly over the East Coast, which is our location around here, as well as in Europe. So what are preventive measures that we could use for COVID-19? With respect to treatments, understand there's no approved drug treatment to cure coronavirus. There has been talk about hydroxychloroquine early in the early in when the virus was taking effect. Understand these are anecdotal studies only, which means that they're conducted informally with no what they call control group to show that whether there was an increase or decrease in mortality. It's important to understand that most recent studies have shown no known effect and that hydroxychloroquine could possibly even be harmful for treating COVID patients. There is a new medication called remdesivir, which does show potential, and a recent study recently showed that it decreased hospitalization days for people who needed oxygen for COVID. There's also a medication called azithromycin, which is an antibiotic. Understand that this works on bacteria and not viruses. Again, there were anecdotal studies showing that there may be some effect. However, there was no control group to show whether the effect was real or not. Another thought is a convalescent plasma, which is getting plasma with antibodies from recovered COVID-19 patients. However, understand that this is still experimental. Finally, there was talk about Tamiflu being used, but again, there was no significant effect found in one study. The one thing I would like to caution is that we must beware of alternative coronavirus treatments, such as herbal supplements, other supplements, or any other housewife cures. Understand that there has been no testing to show that whether these work or not. So from a prevention standpoint, what can you do to protect yourself and prevent the spread of disease? First of all, wash your hands with an alcohol-based sanitizer or with soap and water for about 20 seconds. Understand that you should also wash between your fingers as well as the top of your hands, in addition to the palm of your hands. Second, we want to keep a distance of at least 6 feet between yourself and others, even with a mask. Understand that most homemade masks can still transmit, but they can prevent this, the distance from which the virus spreads. So therefore, it's important that you keep at least 6 feet of distance between yourself and others. Third, try your best not to touch your eyes, nose, or mouth. If you do, just make sure you wash your hands before doing your other activities. Fourth, cover your mouth and your nose with a bent elbow or a tissue when coughing. Masks can be used, however, understand that masks only limit the transmission of the virus by distance. Conventional masks, that is, cloth masks. Most procedure masks can prevent the virus spread by more, but understand these are specially made to prevent any virus or bacterial transmission. Fifth, seek medical attention if you have difficulty breathing and a high fever. And finally, follow directions from the national and local health authorities. In terms of using a mask, before wearing a mask, wash your hands with an alcohol-based disinfectant or with soap and water. Cover your mouth and nose with the mask and make sure the mask is firmly pressed against your face. Do not touch the mask while you're wearing it. If you do, like we said before, wash your hands with an alcohol-based disinfectant or with soap and water afterwards. As soon as it gets wet, make sure to replace the mask. If you're using a cloth mask, make sure you wash it immediately at the end of the day. And do not reuse disposable masks if you have access to those. Finally, remove the mask from behind, and making sure not to touch the sides, and throw it away in a closed container, and then wash your hands with an alcohol-based disinfectant or with soap and water. These are some resources to find out more about the coronavirus and what to do if you're sick. They are excellent resources which physicians will usually use. And thank you for your time in listening to the presentation.